All right, and so Stephanie, I want to ask you as a follow-up, because Scouts BSA, for example, serves both young men and women. Is there not equal care for how we support our young boys and girls, or is it really that lopsided that young men aren't getting the support that they need?
It definitely, I wouldn't say necessarily is lopsided. What I will say is, as a female clinician and therapist, we provide the supports that we need to provide to males and women, or males and girls alike. We identify those emotional supports that are needed. We identify some of the maladaptive behaviors that individuals can start to develop. And so we really focus on the challenges that those individuals are having. When I am working with a male youth, I also acknowledge that I am not a male. And so there are some elements that I cannot relate with, no matter how much I try. And so that's why I feel like it is important, absolutely critical, to have more male role models amongst and around youth in general, because I can model certain behaviors and those behaviors can be shown out through the youth, both male and female. And I think that's important for males to have individuals to look up to, just as females have individuals to look up to. And that can go across either spectrum. So it doesn't have to be just male to male modeling and male to or female to female modeling. We understand that there are some skills that we possess as females that could go across. Like, we can all be caring. It's okay to be caring as a male or a female. That doesn't require a gender specific in order to have that type of characteristic. But there are some things that males need to understand and learn from males.
Understood. One of the questions that we were submitted by parents is the question of, are mental health symptoms the warning signs? Are they different if they stem from bullying or abuse than from chemical or physical issues? Who would like to take the lead on this? I know we have one doctor on the panel, but who would like to take this? Bart, you want to take this? All right, let's go ahead and bring the mic down for Bart. Bart, is there a difference between those two situations that parent proposed?
So this is really important to talk about, because there might be, but often when youth are feeling distress, whether that distress is a result of substance use, whether that stress is a result of bullying, or that distress is a result of something going on inside of them, it can look very similar. You've heard the panel talking about this already today. One of the things we should be looking at, are there significant changes in the youth's behavior? Is something going on? Sudden change in academic performance, sudden change in sleeping patterns, loss of friends, all of a sudden isolating, all of a sudden on the phone. If someone is using drugs and alcohol, you might see different signs. For instance, they're probably going out more often. They're hanging with kids that you don't know. Those are things to look out for, right? If there's anything parents have control over, this is really important. Who your kids are hanging out with may have one of the most impactful things on their development. So this is something we as parents should really attend to. Who are your kids hanging out with? As parents, we should be looking out for signs of distress, disruptions in sleep, disruptions in mood, changes in behavior. There can be lots of different causes that all look exactly the same in terms of the cluster of symptoms we're experiencing. And rather than trying to help you differentiate what might that be, much better to just focus on, what are you noticing that's different? What are those pain points? What are those stress areas? And then getting a professional involved, because then we can help figure out what's going on. Because sometimes it may be a bunch of those things at the same time, right?
Something that we've talked about, in fact, you just mentioned drug or alcohol abuse. Drew, something that we said, we talked about earlier, I'd like you to address here with the panel, is what Scouts BSA as an example can do for our young people in trying to avoid substance abuse.
Unfortunately, as substances have become normalized part of behavior, it has become an understanding that these are actually good, acceptable for you at a very young age. And we stand to disagree. And so it becomes very important for us to, from a very young age, to encourage parents to involve their children in organizations that have structure, that have mentoring, that have goals, and are able to do reward systems in both in the Girls and Boy Scouts, that they have the progress, the badges, the ability to know that they're succeeding, that building of confidence, the building of achievement, to the point that we are taking them in a direction of self-understanding, of self-realization of where of their internal strength is, versus waiting for it to come from the outside and be delivered by substances.
Melinda, I did notice that you were shaking your head a little bit. As a parent, I mean, do you have an example of maybe seeing that structure benefiting a young person, whether that's your own children or another youth that you're familiar with?
Absolutely. And I think it's wonderful that one of the benefits of living in a large metropolitan area is the abundance of resources and opportunities that are out there. Now, we can talk a lot about being able to access it, being able to afford some of that if you're coming from a low income background. But here in St. Louis, we have a large number of those opportunities, out of school opportunities for kids to be engaged, and a wide variety of them. It doesn't have to always be sports. We have opportunities for one of my children was very heavily involved in sports. She did anything and everything. My son hates competition. That is what causes anxiety in him. He does not like to compete, particularly on a team, because he doesn't want to let people down. So what has been his saving grace is his high school has an esports program. Now, we could argue I don't like him on the computer playing computer games all the time, but he's telling me he's practicing. So I can't argue, but that has been the most wonderful thing for him, to be able to do something outside of school hours, but also be engaged with other kids like him who have a passion for computer sports. And so it's engaging them, finding those opportunities for them to be structured, to be focused, and to be able to use to continue to develop those social skills. How do I interact with other people? How do I work together? How do I problem solve with others? Those are vital skills for us to learn as when we're young, that we're going to need through the rest of our lives.
You know, David, you mentioned earlier here that you were just at a Cub Scout meeting, so you kind of have a front row seat. You can take the microphone. You get a front row seat at how this is working, and those opportunities, they continue as our scout gets older.
Oh, yeah. Yeah, I think that especially, with the Cub Scouts, and my daughter just started the Cub Scouts, and it was really interesting to see how she was kind of automatically welcomed into everything, and it was all boys and her, and it was just, just to be involved in something is really, really important. She's a person that does not like competition either. She likes to play sports. She likes to do those things, but she's very social. She needs that, and it made me think about it. We keep coming back to this idea of opportunity, but parental opportunity is, and like, for example, I go in the morning with my daughter, my older daughter. She just started high school, and you said, oh, they get up real early? Yeah, they do. So I bring her to the bus at like 6:30 in the morning. No. But I do that on purpose. She could walk to the bus, but I go, and it's amazing the conversations we've had in that short drive, like talking about drugs and alcohol, talking about things that she's worried about, in school. And I didn't even know that was going to happen, but I was just like, I'll keep going with you, because she's actually talking.
Drew, real quick.
I would also like to mention at this point that I acknowledge the Scouts for having the opportunity to engage special needs children and adolescents. I have treated many special needs kids who have been part of Scouts, and that structure, that bonding, that modeling has helped them grow in their specific social track. And for that, I am just grateful for that invaluable involvement.
Wonderful. Real quick, Bart.
So we need to build on this, because what's being said is incredibly important. Face-to-face time with other people is incredibly important for positive mood. A lot of the joy that comes from our life is when we're around people in the same space. What's interesting is men require that more than women. Women can talk on the phone and maintain their relationship to the same level. Men maintain relationships by doing things together. That's why video games online is one of the primary areas where lots of young men are getting their social needs met, because they're doing something together. So that's why Scouts are so important, and opportunities to get people together in the same place, doing the same thing together. Muscle bonding is a very real thing.
No, you're fine. You can't talk until you're the mic, David. Come on.
I'll say one thing just to follow up on that, because I think that's really interesting. This was in Ireland a long time ago. There was a lot of men out of work, and one of the things, and suicide rate for men went way up high. But what they did was they started these workshops, and the workshops, they didn't do anything except sit and make cabinets or, something like that, and
Real manly work.
yeah, or whatever it was, but there was a project they were all working on together, and it really did, like you were saying, it made a big difference in what was happening over there, at least.
Let's go ahead and pass the mic to Drew, because through this conversation that we've had, we've talked about, how do I identify traits with a young person who may or may not need support? How do we engage them with a professional to get that support? At some point, potentially, medication, prescription is offered to a young person. Drew, I'm curious, we have a question from a parent that's asking, I'm concerned about over-medicating my child. Is medication always necessary in treatment? Are there other options?
That is a very common question that comes before me, and I'll tell you, every parent has that question, which, I have to be very, very, very honest with parents. As an adult, it's hard to take medication. It's even harder to give your child medication. So when you are at a point that you really are at crossroads, we have to know, is there anything that we want to explore? Absolutely. Who would want to jump to medications if there are things that can happen? But there are times when medications are appropriate. We are in a society in which we have made strides in treating all kinds of mental health disorders. And for that, we should be grateful, but we also should be careful. And so when we start treating children, if there is an appropriate need, by all means, we may start the medication very slowly with very clear indications for what we're treating it for, real close follow-up, and then partnering with the parent in watching the child to see how they react to the medication. And it does not mean that once a child is on meds, they'll be on meds forever. So it's a constant watching and progressing and to finding out what the needs are at that moment, and long-term needs for sure.
Stephanie, I saw you ruffle your papers. Did you want to weigh in on this one, or?
It's definitely individual based.
Yeah.
I definitely believe that there are some elements of mental health illnesses where it can be managed, but it is one of those things where it requires a lot of observation. It does require professional assistance, and we also have to make sure that we are doing what's best for the kid. We don't live in their bodies, they live in their bodies, and so we have to encourage and equip them with the words in order to communicate what it is that they're experiencing.
So I'm so glad you said that, because this leads into my next question from a parent that we had submitted. My teen struggles with his mental health and will not talk to us about anything. How can I support them to open up more?
Sometimes we just have to be there. We have to be present. We have to be actively listening. We have to create a brave space for them to be themselves. We have to sometimes share our own feelings to say, hey, this is how I'm feeling. Okay, I did not have the best morning. The dog peed on the carpet right as I was walking out of the door. So I have to deal with that. And so sometimes we have to become vulnerable in order for us to expect our children or our youth that we engage with to be vulnerable.
Do you want to?
Yes.
Okay. Go ahead, Drew.
The conflict of teenage years and tween years is to find out how different they are from their parents. And so that interaction with the parent is always very difficult, because the child who was the mom's side buddy when they were 6, 7, 8 years old suddenly changes in developmental milestones, and they now start to separate from their parent. So really and truly, we have to be there, like you said, and we have to get information not only from the parent, but try to involve what the teacher says in school, what the friends say, what everybody around them says. And really, we have to be there. Be there, be there, be there. Assure the child that no matter what happens, you are there, because it is a process. It is a journey. It is not an event.
David, did you reach for the mic originally?
I did. I was going to say something about precipitating factors. And you had kind of alluded to this idea that we all have things that are happening, before we actually get together, and we have a conversation. Every single one of us, came into here and something happened right before this, and creating those opportunities to be there with them, but on a specific pattern, to be able to say, hey, remember, we're going to go for a walk. We're going to be doing this, and creating those opportunities and recognizing that they're bringing things into the conversation with you, that kind of stuff.
Bart, what have we not heard that you're wanting to get out there?
We're going to build on that question and all the wonderful advice that this group has been giving. One of the things that is underrated that we really need to talk about, if you want to strengthen your relationship with your child, spend more time with them. And if you're expecting a young man who isn't particularly open to talking about things verbally, and you're expecting them to all of a sudden be quite eloquent about their internal experiences, stop. That's probably not going to happen, nor does it need to, interestingly enough. What does need to happen is spend time with them and things they like doing, sitting quietly with them, watching TV with them, going places with them, going for walks with them. The research on this is abundantly clear. If you want a better relationship with somebody, you spend more time with them, and you can predict the quality of relationship by how much time they spend together, and the less time, the less strong the relationship is. And time is at a premium right now, and it's hard. We get that. But if you want a closer relationship with your child, spend more time with them.
Drew, one last thought and we're going to move on.
And to meet them where they are. You cannot say, well, when I was your age, my mother told me, and blah, blah, blah. Meet them where they are. Learn what they are listening to, what they are talking about. Learn about what their feelings are, because the only way that you can meet them where they are is actually listen to what is going on around them and not really comparing them and insisting that they follow the milestones that you came through.
I don't know if you heard it, but when you said that, the entire panel went, ugh, yeah, we've heard someone in our life say at some point, back in my day.
Let me tell you, I have had to listen to rap, to grunge. When I used to drive home at night, and that was what was on my radio, because I wanted to know what the kids are talking about. I wanted to know whether the melody of the song is what they're interested in, or is it the lyrics? Because if I wouldn't know where they are and where do I meet them.
I really appreciate that perspective. David, real quick.
So I used to get. This is back in the CD day, but
It wasn't that long ago.
I would have the kids that I'm doing therapy with. We bring in what their songs are, and we would burn a CD. It's
Well, if we're talking about burning CRs, that's a long time ago.
It was so cool, but and that really built and got this. Anyway.
No, that was wonderful perspective. Thank you. One of the questions we've been asked, and I think it's interesting because we talk so much about how do we support the young person before or in crisis, but how do we encourage other people to support a child's mental health? Who wants to take the lead on that? Stephanie, we made eye contact. I'll let you chime in.
No worries. I think the same concept applies, right? Yes, we may not be a youth's parent, but I always think of it as the aunties and the uncles, right?
Yeah.
So we still are creating that relationship. We are still having that brave space. We are still having those open conversations in order for that youth to just feel safe, in order to be who it is that they are, and for us to be able to meet them where it is that they are. So the same advice that I would give parents is the same advice that I would give to any adult that is engaging with youth.
Melinda, really, there's a value in a young person having strong mentors that maybe aren't their parents because it's heard differently. If a message comes from a coach, a teacher, maybe it resonates differently.
Right, and it's important that we as the adults, as the people who are able to be those role models in a young person's life, it doesn't matter if it's my child or not, I can be that role model. My child may not be comfortable coming and talking to me, but there may be another adult, a friend, another parent, fellow parent who they're comfortable of going and talking to them. Same thing, their child might want to come and talk to me. I think living in the St. Louis region, we have access to so many resources that are available. One of them that I encourage everyone to take access to, because it's free, my love language free, is youth mental health first aid. It's something that's available to help us, again, as adults, equip us with the language, equip us with the understanding of what are signs, how do I respond, how do I step in, how do I be that, just sitting there and be an advocate for a youth. We also have it's also available for adult mental health first aid. But that's a great resource. It's virtual. You don't have to go any place. Is a good place to start. But again, reaching out to your school. Schools are oftentimes having community resources coming in and giving presentations on a whole variety of topics around youth mental health and substance use. And so making sure that you're paying attention. What's going on at my kids' school? What resources are they bringing in? What can I go and just educate myself? And how do I be present so that when that young person comes to me, I'm there and I'm situated and I'm ready to listen, to just listen and be with that kid.
And I think that's right where we need to kind of wrap up this conversation, because we've walked you through all these steps, and we also just want to make sure that there's a takeaway. So our promise, I think, for the last hour is we want to talk about this issue and ways we can help your young person. But the next step is, well, where do we go to get that? So you shared some resources. You mentioned the hotline earlier. Are there any resources, before we wrap this up, that we think are really helpful for our parents out there who are trying to be supportive of young people? Doctor, you want to go ahead and take this one for us and just send us where we need to be going?
There's behavioral health urgent care for youth. There are crisis services available. They're starting to get provided at Compass. We have some across the state, and there are crisis access points, crisis clinics. And then also we have open access. We are getting more sophisticated in making these services available. All we have to do is start somewhere. 988 is a great start. Asking schools is a great start. And then partnering with agencies in the community is also a good start.
Wonderful. You got one more, Melinda, for us? Go ahead. Yeah. What's a resource that we need to have on our list?
Another resource that's available similar to 988 is to reach out to 211. That you can call. It is free, available 24/7, 7 days a week, and where you can call and you can say, hey, I need help with utility assistance. I need help with getting a psychological assessment for my child. I need help with what? And they have probably the largest, most comprehensive list of resources, both in nonprofits and the public sector, that are available throughout the St. Louis region. And so I encourage, if you don't know where to start at all, I'd start with 211. If you just need to know what's out there and what services might be able to help me, my family, or my kid.
Wonderful. Well, I want to say, Melinda, Stephanie, David, Drew, and Bart, thank you so much for being with us for this hour, because it's a wealth of knowledge, all the different perspectives. It is incredibly helpful, and we're very grateful to be able to share this last hour with you, whether you've been joining us for the live stream. I want to make it clear that this is being saved as a recording, so this is something that we can go back to and review. If we got to go back and catch, maybe there's a resource or a number that you heard that you want to make sure that you have, you can go back and check that out, of course, available on our website. I do want to make sure I take the time to shout out SSM Health, Behavioral Health, once again, for the sponsorship to make this hour conversation possible. As we've discussed, this is really important. We need to be talking about this more and more with our young people, our young men, our young women. And I want to thank you for obviously investing the time to help that young person in your life. Thank you for joining us in our fight our efforts really to combat mental health challenges and really be there for our young people. Have a great day. We will see you soon.